in EMEA and in the home care segment, where we have two leading players, Air Liquide and Linde, and three followers, so to speak, Nippon Gases, Mesa, and Divisol of Italy, a more European local group. And then, of course, a great number of local players. More or less 50% of the EMEA home care market is controlled by the four majors, and the other 50% by all these local domestic players in different countries. France, given its tariffs and given its dimension, is the largest home care market in Europe. And it's also a market where many French local players have grown to quite significant sizes. Players which are not global players. They are just domestic in France of a good size. What is true is that across EMEA, because of the public nature and public setup of most healthcare systems, 85–90% of the overall business goes through public reimbursement in different ways, as we mentioned. And only 10 or 15% goes through private spend paid by private insurance companies, which is more of a B2B approach to the commercialization, at least. The go-to-market approach, how to address the market, depends on how these services are configured by the national health system in each of the countries. There are two typical major models. One is tender-based, where tenders are auctioned for exclusivity of service in a given geographical space. And this is the typical model running in UK, in Spain, in Italy, and it also started to emerge in Germany by some insurance companies. And then the second model is what we would call prescription-based.